Anesthesia for dogs versus sedation. The facts confirmed and explained by veterinarians. The significance of pain relief and managing the response of patients to various medical procedures has been recognized since the time of the ancient Greek physician Hippocrates, who lived around 460–375 BC. It is truly remarkable that veterinary anesthesia began to be developed in 1847. Although the concept of anesthesia itself may seem simple, the execution of it remained elusive until scientists unlocked its complexities. The main challenge was anesthetizing patients while minimizing risks and safely bringing them back to consciousness. Although anesthesia and sedation may seem alike, they are very different processes with specific applications. Overview of sedation. Anesthesia for procedures that could be painful or anxiety-inducing is a kindness to animals. It also allows veterinarians and technicians to work without the fear of being bitten or scratched by the animal. For instance, a dog may endure a routine physical examination without excessive stress, especially if the owner is accustomed to handling and touching the animal. However, the situation may change during procedures like X-rays or ultrasounds, where sedation becomes beneficial. During sedation, the veterinarian can position the animal optimally for imaging, while still performing necessary preparations, such as shaving the pet's belly. Sedation also helps in cases where dogs would otherwise be too anxious or aggressive to handle the necessary procedure. This capability is a true gift to the industry. However, sedation is not restricted solely to veterinary services. Some puppies even need to be sedated for grooming sessions. A key feature of sedation is that it is typically short-term. For example, your dog may undergo a procedure similar to an outpatient surgery without needing hospitalization. How sedation works. Sedation starts with the administration of specific medications, often injected intravenously, into the muscle, or under the skin. This causes the animal to become relaxed and calm, facilitating the procedure at hand. Veterinarians may choose different sedatives based on the pet's medical history and the level of sedation required, light, moderate, or heavy. Although sedation does carry certain risks, including allergic reactions to medications, animals are generally in a state where they are less likely to respond to their surroundings or what is happening to them. You may be allowed to stay in the room while your dog is being sedated. The animal's reaction is typically rapid, and though the time spent under sedation may seem lengthy to you, it is relatively short. The value of this is considerable. Veterinarians can use sedation for various procedures, ranging from changing a bandage to removing sutures or taking diagnostic images. A significant factor in its usage depends on the individual dog and their temperament. Uses of sedation. As mentioned, sedation is typically used for short-term procedures. This opens up more treatment options for the veterinarian, as they can perform certain tests that would otherwise be impossible with a more aggressive or fearful animal. This can provide valuable information, which may lead to better treatment decisions. Sedation is also more cost-effective than general anesthesia, making it a favorable choice for certain non-invasive procedures. Overview of anesthesia. Anesthesia takes sedation to the next level. It removes several concerns from the table, such as the duration of the procedure, the invasiveness, and pain management. With anesthesia, your dog will be immobile and unconscious, potentially remaining unconscious for a longer period than under sedation. Gaseous anesthesia can be administered continuously at a stable rate until the procedure is completed. It gives the veterinarian complete control over the procedure while ensuring the dog feels no pain during the process. Unlike sleep, anesthesia is better described as a controlled loss of consciousness, overseen by the veterinarian and their team. There are many advantages to this approach. How anesthesia works. Before anesthesia is administered, the veterinarian will assess your dog using the American Society of Anesthesiologists, ASA, guidelines. This pre-anesthetic evaluation is done to gauge the animal's health risks. Thanks to such tests, the likelihood of complications, including death, is kept very low. This provides peace of mind to pet owners who face the challenging decision of anesthesia for their pets. Factors such as age and pre-existing health conditions will be taken into account when considering anesthesia. Both anesthesia and sedation require close monitoring of the animal due to potential risks related to respiratory and cardiovascular health. However, monitoring is even more critical during anesthesia, as it continues throughout the procedure and after the dog regains consciousness. This explains why your dog will need to stay at the clinic following anesthesia. The recovery time can vary, but it can take several hours before your dog returns to their normal state. Uses of anesthesia. One of the great benefits of anesthesia is that it provides a blank canvas for the veterinarian. They can perform invasive procedures and take the necessary time to complete them safely and thoroughly. Many life-saving surgeries would not be possible without anesthesia. You will need to carefully consider whether your dog requires anesthesia for their specific situation. Another consideration is cost. Anesthesia tends to be more expensive than sedation, but in many cases, it is the better option. Other considerations. Ultimately, the decision regarding which method to use lies with your veterinarian. The choice between sedation and anesthesia depends on the procedure being performed and which method is better suited for the animal. Sedation may be the ideal choice for short, non-invasive procedures, while anesthesia may be required for longer or more invasive surgeries. Pain awareness. Understandably, pain awareness is a primary concern for pet owners. We want our dogs to be healthy, but we also want to avoid unnecessary suffering. A conscious animal can feel pain, but a dog under sedation is generally in a drowsy or deeply relaxed state, limiting their ability to feel distress. A dog under anesthesia, however, will not feel any sensations at all. This complete lack of awareness is crucial depending on what the veterinarian needs to do. Risk factors. Both sedation and anesthesia come with risks. Depending on the dog's health, the duration of the procedure, and the required level of sedation or anesthesia, one method may be safer than the other. Discussing the risks with your veterinarian before proceeding with any procedure is essential. Cost considerations. While both sedation and anesthesia require monitoring, anesthesia is significantly more expensive, mainly due to the need for specialized equipment. Pet owners may face financial difficulties due to these unexpected expenses, but rest assured, your veterinarian is aware of these concerns. This awareness often makes anesthesia a fortunate option when necessary. Notably, many pet insurance policies cover anesthesia, making it a viable option for pet owners to consider. Conclusion. Sedation and anesthesia offer distinct solutions to a common dilemma: how to manage a dog during challenging procedures. Sedation is a great choice for quick, non-invasive tasks like changing a bandage, as it keeps the dog calm and allows the task to be completed swiftly. In contrast, anesthesia is necessary for more invasive procedures, such as surgeries, and provides a higher level of safety and control during the process. It is often the safer and required option for certain surgeries and procedures, despite its higher cost.